Hi everyone, how are you? Hey, well, thanks for being here today and for listening to my speech outlining my priorities as the new Minister of Health. I'm very much focused on putting the patient back at the centre of every decision in our healthcare system and making sure that we can achieve timely and quality healthcare for all New Zealanders. Happy to take questions.
Minister, have you effectively sacked?
No. I have full confidence in Professor Lester Levy. His commission continues until the end of July. And I've said today that we will transition back to a board and more traditional governance. But let me be very clear, he has put in place a plan for delivery, and I have full confidence in the work that he's doing to make sure that Health New Zealand is delivering for New Zealanders, and I'll continue to be working with him.
Is this an admission then that the framework your government put in a year ago
No, not
was
at all.
the wrong thing to do?
No, it was the absolutely right decision at the time because the last government had left Health New Zealand, as I outlined, in a state of decline. They'd run it down. They had failed to put in place the financial controls to make sure it was delivering for New Zealanders. Lester and his team have come in and have reinstated that. They've delivered a plan around how we're going to make sure that Health New Zealand is delivering for New Zealanders. He has a very important role in making sure that plan is delivered. And as I said today, we are now transitioning back to traditional board governance as we outline that in that plan.
So what is happening with that reset plan? How does it figure in with the priorities?
Well, that is the delivery plan that was outlined today. So the Health New Zealand's delivery plan, which is outlined today, is the plan to make sure that we have a nationally planned, locally delivered healthcare system that has been put together by the commissioners. That has been released, I think, on the Health New Zealand website today, and that's all about making sure that we deliver better outcomes for patients and for all New Zealanders.
And that board, when is that going to be established
It's been,
fully?
sorry?
The board, when is that going to be?
Oh, look, the commission runs until the end of July. We'll be, as I said, calling for nominations, putting in place a board over coming months. But look, as I've been very clear, I have full confidence in the Commissioner and the Deputy Commissioners and the work that they're doing to ensure that Health New Zealand is focused on delivering for patients. That is an incredibly important role that they play as we transition and to deliver on that.
Sorry, to circle back, how is replacing the Commissioner with a board not a reflection of your confidence or thoughts of his effectiveness?
Well, because ultimately having a commission in place it was put in place because of the situation we inherited from the last government. The commissioners have been brought in to stabilise Health New Zealand and set a very clear direction about where we are going. They've now done that, and now we need to go back to more traditional governance. We want to see more the regions and the districts have very clear output plans, clear budgets, delivering against that, and empowering them to make decisions as part of that. And that's the work that's now underway. Well, that's what's needed. That is the plan that's needed, is we need to make sure that it's nationally planned, but it's locally delivered. And the reality is when Labor centralised Health New Zealand into one mega entity, they took away control, they took away decision-making from local leaders and from the districts, and that has meant that we've ended up with an overly bureaucratic system. It's now about decentralising Health New Zealand, focusing it back on the districts and giving power back to those regions so they can make decisions in the best interests of the patients.
Minister, are you expecting everybody to move to Wellington in order to do that national management?
No, but I am saying that I am expecting that Health New Zealand's head office will be based in Wellington so that it is closer to government and is more responsive and accountable to the government of the day. That is something which I think the last government failed to do. No, it's not about moving staff around. This is about making sure that the head office and the functions are more responsive to government and accountable to the government. You're going to remember here, this is not a mega district health board. This is now a Crown entity that has been set up. Health New Zealand is a Crown entity, and it needs to be accountable to government and respond to government and deliver for patients. But that is about having a nationally consistent and planned approach, but the delivery happens in the regions and in the districts.
So where is the money coming from for that new entity, Minister?
Health New Zealand's already been set up. Yes.
The money for the board.
Well, the commissioners are also getting paid, and so the board members will be paid.
Minister, if you have confidence in the commissioners, why not allow them to continue their work?
Well, I think it's about moving back to traditional governance. That decision has to be made at some point. I've decided that transitioning back to that more traditional governance is the right decision. It's about also making sure that we deliver the plan that the commissioners have provided us. But ultimately, we've been very clear it has to be about what the patients need about local delivery and making sure there's clear accountabilities, clear budgets and all of those things put in
Did
place.
your predecessor make the right decision in July last year?
Absolutely. It was the government decision, it was a cabinet decision, and it was 100% the right decision, because at the time what we inherited from the last government was, as I outlined, was a system in deterioration, both financially and around delivery, and we are turning that around.
How would you describe Levy's leadership?
Look, he has been doing a great job, focused on ensuring Health New Zealand's focused back on delivery. But we need to move back to more traditional governance, and we need to make sure that now we decentralise, focusing back on patients, back on regions and districts, so that we're able to deliver the healthcare that New Zealanders need in a timely and quality manner. So the Commission was never intended to be in place for a long period of time. It was there to make sure we stabilised Health New Zealand and we got it back to basics. That's what the delivery plan that's been released by the commissioners today is all about, and now it's about focusing back on the patients.
So the reset plan itself, are you happy with what it's achieved today?
Well, it's just been released today, and it's about saying how we're going to support the workforce. It's about how we're going to support patients, and how we're going to decentralise Health New Zealand. So whilst it's nationally planned, it is locally delivered. And actually, that is how healthcare works. Healthcare is delivered in local communities. But also, we have to make sure it delivers within its budget and it is improving its output. And as I said in the speech, we've been putting more money in, but we haven't been getting the increased outputs and delivery that New Zealanders expect from the system. We're paying nurses, the same as in Australia. That's great. But we've increased investment in our hospitals. We've increased investment as a government by $16.68 billion over 3 years, but we are not seeing the increased performance. That is now the focus on performance and on delivery. That's what patients expect. And as I said today as well, look, we will work with the private sector. It's not just, it's a publicly funded, but we are open to different ways of delivering, and we've been very clear about that too. I'll give you a question.
So how long did you have in mind that you were going to go back to the board model?
We have been, the Cabinet's made that decision, but Cabinet was very clear. The Commission was put in place for 12 months. It was always intended to be for 12 months. And so all I'm doing today is confirming that we'll be going back to a board. But more importantly, we're focusing the organisation back on delivery for patients. And that's what the system needs to be doing. We're focusing back on patients.
So when do you expect to announce the makeup of the board?
Well, look, as I said in the speech, we'll be calling for nominations. That'll be a process to go through due diligence. It's also going to be a transition, because ultimately we need to make sure that there is good people who are appointed. It's a huge organisation. It's a $30 billion organisation. This is not a small organisation. It's one of the biggest in the Southern Hemisphere. And so that transition is going to be very important. I expect the Commissioner will have a role to play, a very important role to play in making sure that we have stable governance ongoing as part of that, because ultimately we need to focus this organisation on delivery.
Do we have a similar makeup to the previous board in terms of having a wide range?
Well,
of
look,
people
we'll be going through a process. I want the best people in New Zealand on this board. I want the best people who have a track record in delivery on this board to make sure that it is delivering for New Zealand. It's a $30 billion organisation. It's one of the biggest organisations in the Southern Hemisphere, and every single part of that organisation needs to be focused on delivery and with clear accountability from the government through to the delivery, right down to the ground.
Do we have the healthcare workforce? Do we have the healthcare workforce to clear that 10,500 elective surgery backlog?
Look, absolutely, and we're going to be partnering with the private sector. And this is what the last government they put together a planned care task force back in, I think, 2022, released a report. There's about 103 recommendations in it. That report, all it's done is gather dust, but it said all of the things that we're doing now. It said partner with the private sector, make sure you're enhancing how your operations are happening in your own with your own workforces. They ignored it. We are doing what it said we should do, and we're delivering on it. And actually, there is a huge amount. I've met with many of the private hospital providers. There's a lot of capacity, but more importantly, we also want to make sure that there's a partnership going forward. It's not just an ad hoc do something for 3 weeks as it's been in the past. It's actually a long-term partnership, so we can actually grow a shared workforce together. And I think one of the concerns in the past has been that it's about competition. Actually, our competition's with Australia, not with ourselves. And that's the focus that I want to have as we outsource those elective surgeries.
You're guaranteeing those 10,500 people on that wait list
Well,
by the middle of this year will have had their surgeries.
Well, that's the contractual process that Health New Zealand's going through. They've allocated the resource, they're contracting with the private sector to be able to deliver that. And we need to do that because there are too many people waiting, and we need to have a real focus on reducing that backlog.
And what happens if we don't have that 10,500?
Well, we're going to continue to focus on this issue. That is one of my top 5 priorities, is making sure we get on top of the elective surgery wait list.
Minister, you got a great response about the number of applications per number of staff.
Yes.
There are 40% of the data and digital team are being proposed to be disestablished. So how are you going to get on top of that situation?
That includes, if you take into account current vacancies, that number that you've just provided to me, so it's not an accurate number. But what I would say is, yes, we have asked Health New Zealand to look at their proposal around data and digital to make sure that it is going to be able to support the current systems. We do need to have it. We do need to transition to, proper 21st century systems at Health New Zealand. That is going to take some time. In the meantime, we need to make sure we're supporting those existing systems so that we can provide the care patients need and support clinicians in the important work they do. So I've asked Health New Zealand to look at that and to assure me that is going to deliver for patients.
And when do you hope to have that resolved by in a system that you're satisfied?
Oh, look, I want all of those proposals around the changes in the back office bureaucracy to be concluded by the middle of May. We need to make sure we are getting the change completed so that we're able to focus solely on delivery. But that change is about making sure we're driving efficiencies. Health New Zealand, you've got to remember, is 20 DHBs put together into a singular bureaucracy. The intention was to find efficiencies in the back office. That is underway. That is important, but we want that change to be completed so we can focus the entire organisation and every one of the tens of thousands of people working for Health New Zealand focused on the patient and delivering for them.
Will you be partnering with the private sector on that digital reinvention?
Oh, look, I've said we're open to all types of opportunities within the infrastructure space around how we can utilise private sector experience. And also private sector investment. So we're open to those opportunities. I'm very agnostic around that.
Are you asking any of the previous board members or executives to return?
Look, I'm focused on making sure we have a board with the best people in New Zealand, and I want to make sure that those are people who have a track record in delivery, because that's what New Zealanders expect. And look, there'll be open opportunity, but I'm focused on getting the best people in New Zealand.
On your bowel cancer screening
Yes.
announcement, Māori Cancer Leadership Network have called the repurposing of that funding for lowering the age for Māori and Pacific peoples and giving it just to everyone, institutionalised racism. What's your response to that?
Look, we are saving more lives than what was going to be done under the previous government's proposal. There'll be 178 fewer deaths from bowel cancer because of the changes that we're making. And we're also committed to aligning the age with Australia as we can increase the number of colonoscopies in our health system. So we're focused on saving lives, and we will, as quickly as we can, lower that age even further to align with Australia so we can even save more lives.
Is there any indication on what as quickly as we can means?
Well, the critical thing here is access to more colonoscopies. So if we can increase the number of colonoscopies in our health system, we will move faster on reducing that age.
You spoke a lot today about the
Two more.
actions of the past government, and now your government's been in place for a year. How much of that responsibility lies on you guys?
Well, we're focused on the patient. They were focused on bureaucracy. We're focused on delivery. They were focused on reorganising the organisation. So we are here saying very clearly what our priorities are: elective surgeries, primary care, infrastructure, making sure we're focusing Health New Zealand on delivery. And we've set targets back in place for the organisation to respond to. And we're going to hold Health New Zealand accountable to deliver against those targets. That's the focus that we're bringing.
Were you focused on patients last year?
Absolutely. We've been focused on patients the entire time we've been in government. That's why we put one of the first things Dr. Shane Reddy did was bring back health targets. If you don't measure it, you're not going to be able to actually manage it. That's why he brought those back. That's why the government brought those targets back. The last government should hold their head in shame because they got rid of those targets, because every single one of them went backwards under their watch, and they should look in the mirror before they start criticising.
Just on some comments from the ACT Party talking about how regulatory bodies need to stop using the treaty to justify using ideology over science in their competencies. What do you say to that?
Well, look, I want to have a health system focused on need, focused on delivering for patients, and making sure that every part of the system is delivering for patients. And so when it comes to our regulatory bodies and their and the workforce regulatory, I will have more to say about that in the near future. But what I would say is that some of the rules and regulations that are put in place, I think I made this point about the Pharmacy Council the other day, I think make it harder for some workforces, or particularly if we're trying to attract international people to come to New Zealand, we make New Zealand a less attractive place to come. So we need to make sure we are focused on patients and we're focused on ensuring that we can maximise our workforce, and that's the approach that I'll be taking, but I have more to say in the near future. Thank you very much. Thanks everyone.